A new long-term care facility for Swift Current has been on the Cypress Health Region's wish list and that of local residents for a number of years. Back in May, Saskatchewan Premier Brad Wall announced that the province continues to support the health region in principle for a new long-term care facility. The province initially invested $450,000 3 years ago for the creation of a capital plan. Now, since May, the Cypress Health Region put out a request for expressions of interest for the project and received a response from 12 separate parties.
These were all companies who have experience in alternate funding of long-term care or healthcare facilities. And so the expression of interest, all that really does is allow us to know who might be interested should we go forward.
The proposed 225-bed long-term care facility would be located next to the Cypress Regional Hospital at a cost of approximately $60 million. The usual funding structure for any new healthcare facility in Saskatchewan, once approved, is split on a cost-sharing basis, 80% by the province and the remaining 20% by the community. However, Vachon indicates the province of Saskatchewan is already committed to a number of capital projects, and the health region now needs to investigate alternate funding. Here's where the hiring of a financial advisor comes into play.
We need to develop a business case. So what that business case will start to tell us is what is the kind of funding model that most makes sense for this project in this community. And so what we do is we look at things like the traditional 80-20 split. So that'll be one of the models that's looked at. We would look at some of the design, build, finance, maintain models. There's also design, build, finance, maintain, and operate. So there's a number of different ways that this could go. And again, just knowing the commitment that the provincial government has already made to the capital projects that are ongoing, if we want to move this project forward, I think we need to be creative and look at some different ways that we can potentially fund this.
And as far as any target dates for the project, Vachon indicates things will happen in a series of steps. The financial advisor should be hired by the end of August, with a business plan in place by October, with the hopes of then heading into the appropriate tendering process. Once constructed, the new long-term care facility in Swift Current is intended to replace the Palliser, Swift Current Care Center, and Prairie Pioneers Lodge, all constructed between 1957 and 1966. Southwest TV News will continue to follow this story as it develops.